Hello, this is Dr. Eric Bricker, Chief Medical Officer of First Stop Health, and I'd like to speak with you briefly about the lack of physical exam in a virtual primary care visit. So, of course, if you are visiting a primary care physician either over the phone or via video, then they're not doing a literal in-person physical exam on you. Okay, so what does the medical literature have to say about the actual physical exam with a primary care physician? Well, believe it or not, there have been studies about it. There was a meta-analysis, which is a study that actually lumps together all the other studies that looked at 14 studies. Does the physical exam for the quote-unquote annual checkup with a primary care physician improve people's health at all? And the short answer is no. There is no benefit to morbidity or mortality from the actual physical exam. Now, another study found that really the utility of the annual physical from the primary care physician was in accomplishing the tests and the screenings that are recommended from the U.S. Preventive Services Task Force. Well, okay, what are those? Those are things like mammograms and colonoscopies and cholesterol checks. Okay, fine. Obviously, all those things need to be done in person, but you can have a referral from the primary care physician to the lab or to the imaging center or to the gastroenterologist for the colonoscopy without literally going into the primary care physician's office for the physical exam. In other words, you can accomplish the screening tests that are recommended that actually can improve morbidity and mortality without having to literally go in. The actual going into the primary care physician part doesn't add any benefit. So much so that the Society of General Internal Medicine, in other words, the internal medicine physicians that act as primary care physicians, actually recommend against the annual physical exam in asymptomatic people. If you're just like a 34-year-old person and you're feeling fine, the Society of General Internal Medicine recommends that you do not go in annually to have a physical exam done. So, with that being said, the lack of an in-person physical exam for virtual primary care should not be viewed as a game stopper and prohibiting the use of virtual primary care, because the literature just does not describe it that way. And thank you for watching.